Hi, it's Dr. Noel Williams, November 18, 2020, COVID update, Optimal Health Associates. So, a lot of stuff going on in Oklahoma right now. The COVID numbers are again skyrocketing. I think 3,700 positives yesterday. Our total, I've lost track of. It may have been 24 more deaths. So big numbers. I guess the news to know is the hospital saturation rate is going pretty high now. We're kind of hitting ceilings, at least in central Oklahoma. So the big focus for us is, improving logistics still, perhaps doing some collaboration with other subspecialty or specialty hospitals, things of that nature. In terms of the patient management side, the Oklahoma Health Department is working on that with Lance Fry. Then we're initiating really a major focus on preventive strategies for the state of Oklahoma. You'll be starting, hopefully to hear some faith-based messages, both across all the different churches in the state over the next few days, more public service announcements and everything. The bottom line is this: you have to do something to help with the spread. So it's one, wear a mask. Wear a mask, wear a mask, wear a mask. Don't get caught in the debate about do we need to mandate it or not, because the mandate is going to make the people who really don't want to wear it. So just do it yourself. 2, wash your hands, socially distance, take your vitamins, and then judge your activities. And so what's a bad activity? I'm going to go to a friend's house and play mahjong with 4 friends and have tea or a glass of wine or something and not wear masks and do it inside. That's the exact wrong thing to do right now. Sorry. You want to limit your inside interactions up close. It is an absolute must. You want to try to keep your households together and separate from other households. If you're going to church, you need to wear a mask. Going to church right now in person in a crowded environment is a very bad idea. It is a very bad idea to be in a crowd anywhere now in Oklahoma. Bedlam is a disaster if you're going to Bedlam. Isn't it more convenient to watch it on TV and have your own bathroom? That's how I always looked at it. But so it's about safety. There's no beds in the hospitals. There's no beds for people who are sick. I had a very sick person in the office today, not with COVID, it was something else. They did not get admitted after going to the ER. I don't know if I totally agree with that, but be that as it may, there wasn't a place to put the person. So that made it an easier decision probably on the ER's part. So again, there is a true limit of healthcare services available at mainstream large hospitals that do the big picture care. And the medical professionals, whether they're doctors, nurses, support staff, respiratory therapists, security officers, all of them are worn slick. They're tired. The healthcare system is getting just stressed to the max. And it doesn't matter if it's Integris, Mercy, Saints, OU, Comanche County, Midwest City, or Norman, and our whole region. Every single system is getting crushed. A big shout out to Scott Molitor at Comanche County for giving a report on the national news yesterday. And again, a shout out to Julie Watson for being interviewed on MSNBC today. It's kind of interesting. Some of these wonderful doctors in our group are being on national TV. David Chansome has 2, so that's pretty rare to have 3 doctors in one little task force. So I'll be on national news channels, so that's exciting. Shows that we have good people, highly intelligent, motivated people. Let's think about the nurses, though. If you know a nurse, really try to be supportive to them. They're working very, very difficult hours and jobs that are exhausting. Same with all the support people. Think how you can support anyone you know who's in healthcare, who's taking care of COVID patients or working at these hospitals. That's what we need to do. That's what I try to do. I'm doing everything I can right now to help with care coordination and positive messaging and being a unifying force for our state for COVID, because we have to band in together. There's no place now for recriminations or criticisms. It's all about the focus on the patient and the healthcare providers who are putting their lives at risk. And let's be supportive. And dysynchrony and hyperbole that's nasty doesn't help them. Doesn't help them at all. And let's remember why I've been doing this and why so many of us spend countless hours on this. It's because we care about people and want people to do well. And so be respectful of that. So don't sit there and criticize from afar. Instead, if you are a mask person, send out Julie Watson's speech. It's beautiful. Send it out to everyone you know. If you're very strongly anti-mask, I'm not going to yell at you or anything, but just keep your distance from everybody at least. Be respectful to their desire to wear a mask and not be around people who don't wear masks, because the science is on their side, unfortunately, and not on your side. It's not about emotions any longer. It's just about what can we do to help each other, because you don't want anyone to die of it, and we don't want anyone to be disabled. And so that's the message tonight. Just the state's inundated, the whole country's becoming inundated, and we just all need to stick together and be positive and not be nasty. So that's it. There's Kim, but anyway, she just walked in. So you all have a great evening and take care and don't go to Bedlam. Thank you. Bye.